Hello and welcome. Today, we're diving deep into a serious condition affecting the kidneys: radiation nephropathy. This video will explore what it is, what causes it, how it impacts your health, and what can be done about it. We'll cover everything from diagnosis to treatment, so stay tuned to learn more about this complex disease. Radiation nephropathy, simply put, is kidney damage caused by exposure to ionizing radiation. The most common culprit is external beam radiation therapy, a cancer treatment. While radiation targets and destroys cancerous cells, it can unfortunately also affect healthy tissues in its path, including the kidneys. The amount of radiation, the area of the kidney exposed, and individual susceptibility all play a role in whether or not radiation nephropathy develops. Less commonly, internal radiation from certain radioactive isotopes can also cause damage. So, what exactly happens inside the kidneys when exposed to radiation? The initial injury primarily targets the small blood vessels, called capillaries, within the glomeruli, the kidney's filtering units. Radiation causes damage to the endothelial cells lining these vessels, leading to inflammation and thickening of the vessel walls. Over time, this results in reduced blood flow to the kidneys and ultimately, scarring and fibrosis of the renal tissue. The tubules, which are responsible for reabsorbing essential substances and excreting waste, can also be directly damaged. These processes gradually impair the kidney's ability to filter waste and regulate fluid balance, leading to kidney dysfunction. Radiation nephropathy isn't incredibly common, but it's a significant concern for cancer survivors who've undergone radiation therapy involving the abdomen or retroperitoneum, the area behind the abdominal cavity where the kidneys reside. The exact incidence varies depending on the radiation dose, the area treated, the patient's overall health, and pre-existing kidney conditions like hypertension or diabetes. Patients who have already had a kidney removed are more susceptible, as the remaining kidney receives a higher radiation dose. It's also important to understand that the risk of radiation nephropathy can persist for many years after radiation treatment concludes. The signs and symptoms of radiation nephropathy can be subtle initially, often developing gradually over months or even years. Common early symptoms include proteinuria, which means protein in the urine, and hypertension, or high blood pressure. As kidney function declines, patients may experience fatigue, fluid retention leading to swelling in the legs or ankles, loss of appetite, nausea, anemia, low red blood cell count. In severe cases, radiation nephropathy can progress to end-stage renal disease, requiring dialysis or kidney transplantation. Diagnosing radiation nephropathy can be challenging as its symptoms often overlap with other kidney conditions. The diagnostic process typically involves a thorough medical history, including details of prior radiation therapy. Urine tests will be performed to check for proteinuria and other abnormalities. Blood tests will assess kidney function by measuring creatinine and blood urea nitrogen at BUN levels. Imaging studies, such as ultrasound or CT scans, can help visualize the kidneys and identify any structural changes. In some cases, a kidney biopsy, where a small sample of kidney tissue is examined under a microscope, may be necessary to confirm the diagnosis and rule out other potential causes of kidney disease. While radiation nephropathy isn't typically classified into distinct types, it can be categorized based on the time of onset after radiation exposure. Acute radiation nephropathy occurs within weeks to months of radiation therapy, while chronic radiation nephropathy develops months to years later. The chronic form is far more common and insidious, making early detection and management critical. Unfortunately, there is no specific cure for radiation nephropathy. Treatment focuses on managing the symptoms and slowing down the progression of kidney damage. Blood pressure control with medications like ACE inhibitors or ARBs is crucial to protect the kidneys. Proteinuria can also be managed with medications. Diuretics may be prescribed to reduce fluid retention. Anemia can be treated with iron supplements or erythropoietin agents. Dietary modifications, such as limiting protein and salt intake, may also be recommended. In advanced cases of kidney failure, dialysis or kidney transplantation may be necessary. Prevention is paramount when it comes to radiation nephropathy. During radiation therapy planning, careful attention should be paid to minimizing the radiation dose to the kidneys while still effectively treating the cancer. This involves using precise radiation delivery techniques, such as intensity-modulated radiation therapy (SIMRT) and image-guided radiation therapy (IGRT), which allow for more targeted radiation delivery. Protecting the kidneys as much as possible during the radiation therapy can reduce the likelihood of developing radiation nephropathy later. After radiation therapy, regular monitoring of kidney function through blood and urine tests is essential for early detection and management. The prognosis for radiation nephropathy varies depending on the severity of the kidney damage and the individual's overall health. Early detection and management can help slow down the progression of the disease and prevent complications. However, in some cases, radiation nephropathy can progress to end-stage renal disease, requiring dialysis or kidney transplantation. Recent research is focused on developing strategies to protect the kidneys from radiation damage and improve the treatment of radiation nephropathy. These include exploring the use of radioprotective drugs and stem cell therapy to regenerate damaged kidney tissue. Ongoing clinical trials are investigating new approaches to prevent and treat this challenging condition.
Thank you for watching.